Hey everyone, today I'm going to be making a lemon corn cake with lavender and rosemary while I answer all of your questions that you've sent me on Instagram about RNtoMD. This is what we're making today. Doesn't that look delicious? All right, I have to zest a couple of lemons, 2 medium lemons. This is a lemon corn cake, so that's gonna be an interesting combination of tartness and cornmeal. So let's answer the first question. Did you take your pre-med classes in person or online? I took my pre-med courses at a community college because I was working as a full-time nurse when I was doing my pre-med prerequisites. I wanted to have the flexibility of being able to take classes in the evenings and also on the weekends. So community college really allows that flexibility. A lot of the university classes were not as flexible and typically throughout the week during the morning hours. I also ended up taking a lab course online. I took physics 1 and 2 at a community college that was online. I researched online physics lab courses and found one. So I was taking all of these courses in Arizona at the time, and I found one in, I think it was like New Jersey, called Ocean County Community College. And they had physics courses online that you could take. And it was really interesting because the lab course, they send you a box of all of the physics labs materials. And so I was able to do all of those physics labs at home. And I had to record myself doing those labs and then upload those videos into like the online learning platform. And that's how I was able to take online lab courses. The rest of my pre-med prerequisites was at a community college in person. I personally learn better in person, so that's what I preferred. I did think that the online courses that I did ended up being a lot harder just because it's not as easy to ask real-time questions when you're struggling with a concept. And I felt like doing it in person allowed me to really understand things and grasp things a lot better. I don't think that I thrived doing physics online. I don't think that those concepts really stuck to help me thrive on the MCAT on those. So I don't typically recommend it for people who are taking pre-med prerequisites. If you can, try to take things in person. You're just gonna get so much more out of it, and then you'll be able to get a letter of recommendation from the professors and instructors that you work with. You don't get that personal connection when you're taking stuff online, so you're not gonna be able to get a strong letter of recommendation. So it's not typically something that I recommend for people. January, you asked your thoughts on the difference in internal medicine and family medicine. Think of internal medicine as medicine for adults, people who are 18 years and older, and that does not include pregnant people. Family medicine is medicine for the entire family, young to old, and includes children and pregnant people. Family medicine doctors can end up delivering babies. Whereas when I think of internal medicine, I think of doctors who want to be hospitalists, take care of sick adults in the hospital. They can do primary care, take care of sick adults outside of the hospital, follow them up as a primary care doctor. And a lot of times what people end up doing when they finish internal medicine residency is doing a fellowship and subspecialize. So then that's where you get your endocrinologists, you get your pulm crit doctors, your oncologists. Those are all the subspecialties that you can go into when you've done internal medicine. Zested 2 lemons, milk and lemon juice. Here's the milk. I put it out early so that it can get to room temperature. And then I need to put some lemon juice. How many? I got a question about what work bag I use to go to work. I don't use a work bag. I bring a backpack. I have a High Sierra backpack that I bring. It has a ton of pockets, and I'm able to bring an umbrella. I put my water bottle in it, my smoothie. I have a laptop in there, a sweater because it always gets way too cold in the hospital, and all of my snacks. So I use a work backpack, not a work bag. Another question is, do you think doing the prerequisites at a community college hindered your application? I get this question a ton. This is one of those answers where it really depends, because the answer to this is going to be based on the institution that you apply to. Every institution has their own individual and different requirements. Some places are biased against community college, and some places like the medical school that I went to is very open to it, and they don't really scrutinize that. This is going to really depend on the institution that you're looking to apply to. I think that if you're applying to a top 20 medical school in the nation, you probably want most of your credits to be from a university. Oh my gosh, I'm having so much trouble juicing this thing. With any specific prerequisite questions that people ask me, you really need to check with the specific institution that you want to apply to see if they even accept community college credits. Some places won't even accept it. So first you need to figure that out, if they accept it. And then you can reach out to the admissions committee and ask them what do they prefer and what majority of students have taken pre-med prerequisites at a community college. I ended up applying mostly to DO schools, which are very holistic in their screening of applicants and are not typically biased against community college pre-med prerequisites. I applied to one MD school. One MD school, I got one MD interview and I got one MD acceptance. That's the school that I ended up going to. They're very holistic in their screening process, and I think they were very holistic in accepting me. So the answer to that is really it depends. It depends on where you want to go to, where you want to apply. All right, I need to put 6 tablespoons of lemon juice in here. Buttermilk. This is when you're baking with vegan ingredients, often you make some type of buttermilk when you're making a cake. Usually it's milk and vinegar, but sometimes it's just something else that's acidic, like lemon juice. Here's another question. I'm about to start taking pre-med classes with RN school. I'm pretty scared. Any advice? I think it's pretty fair to feel scared. You're going into something completely new, challenging, and actually starting a pretty long and arduous journey. There's also a lot of misconceptions about med school. People think that it's impossible or like it's just like the ultimate academic challenge. But I was also afraid of it before I became familiar with it. The more familiar you become, I guess the easier it is. And I loved med school, so I don't know. I think being scared is legitimate, and I don't want to like minimize that for anyone. Now, what you're doing is taking pre-med prerequisites during nursing school. That is not what I did. I don't even want to recommend that to anybody because doing pre-med prerequisites in and of itself is so time consuming and requires a lot from you. And you actually want to do very well in those courses. At the same time, nursing is very challenging and you want to do well in those courses as well. So doing pre-med prerequisites during nursing school, that's not something I did. I think that nursing school grading was really honestly unfair, and having such a high bar to just getting an A in the class was kind of obnoxious. But because of that, we all had to work so hard to get an A on our transcript because they required us to have to get a 94% to even get an A. And you want good grades because when you apply to med school, they're going to be looking at your GPA. So trying to balance med school and nursing school just sounds like it's a recipe for burnout. So just be really careful on how you time those things because it can really come back and bite you in the butt. I always have this saying that I follow, pay now or pay later. I think it's okay to take your time. It's okay to put your energy in doing well in nursing before you start those pre-med prerequisites. I do often feel like people are in such a rush to get things done. They want to take like 14 credits all at once to get all of their pre-med prerequisites done in like one semester. It's so hard to really do well and prepare yourself for the application season if you're struggling so much trying to balance 14 credits of pre-med prerequisites, which is not easy stuff. In hindsight, what would you do / not do for your MCAT studies? MCAT was such a beast of an exam, and I feel like it wrecked me. It was much harder than taking step 1, step 2, and step 3. It's just so much information that you've learned over so many years. I struggled a lot with the CARS section, which is critical analyzing and reasoning section, mainly because I ended up losing an entire passage when I took the actual exam, and that cost me a lot. But what I would do differently now that I'm on the other side, first of all, if you are doing really well on a section of the MCAT, like say you just always score very highly when you take the chemistry and physics section of the MCAT, you need to stop doing so many practice questions in that area. Do practice questions in areas that you are not doing well on. I think that was what ended up hurting me because I did so poorly in the CARS section, and I would avoid it like the plague because I just hated feeling so terrible about how I was doing, so I would just avoid studying it. And you can't avoid your weaknesses. Like if you're not doing well in a section, you need to spend most of your time studying on that section. Also, focus more on doing practice questions than content review, because you can do those things simultaneously if you're doing practice questions often. So as you're doing practice questions, you can review all the questions that you get wrong and right, and that will become part of your content review. So I would say focus mostly on doing questions, and questions in areas you're scoring the worst in. Here's another question. Did you do one pre-med subject per semester, and were you full-time RN? How many years total? I worked as an RN for 5 years. During those 5 years, I took pre-med prerequisites for 3 of those years. The nice thing about being a full-time RN is that you can work 3 days a week. So I worked 3 12s for the majority of the time that I was doing my pre-med prerequisites, and I took 1 course a semester. So 1 course over, 16 weeks? That felt really manageable to me, and I was able to excel in those courses and get A's. I think I ended up getting all A's in my pre-med prerequisites besides in biochemistry, which I took online and really struggled with. I don't think you need to take 1 pre-med course per semester to do well. I think people could take more than that, but I was in no rush. I wanted to take my time. I was still deciding between going to NP school, PA school, and getting my medical degree. So took my time, gave myself a lot of time to reflect and think about what I wanted to do. Applying to medical school takes 1 full application year. During that year, you're applying to medical schools, you interview for them, and then they give out acceptances. So you're like taking the MCAT, applying to med school, doing your interviews, and then it won't be until the following year until they actually accept you. When I applied to medical school, I had not finished all of my pre-med prerequisites yet. I still had physics 2 to take. So I had everything done, and then when I was accepted, I sent my transcript to the school that I was accepted to so that they can see that I actually did finish my pre-med prerequisites. I've never cooked with dried lavender before, so this is exciting. It smells like it shouldn't be edible. All right, here it is. It's gonna go in the oven for 40 or 50 minutes. All right, my cake has to bake for 45 minutes, so I'm going to answer some more questions that I received on Instagram. Is it typical to move after your intern year? Is that specific to your program? Curious. Moving after intern year is specific to radiology, but it's also specific to other specialties. These include the road specialties. If you've ever heard of the road specialties, they're kind of known for being the lifestyle specialties. ROAD stands for radiology, ophthalmology, anesthesia, and dermatology. But I believe other specialties, including radiation oncology, does a separate intern year. You can apply to categorical programs, but they're very far and few in between. Typically, these advanced specialties want you to do a intern year that's in medicine or surgery so that you can get a strong clinical baseline before you go into these very specialized fields. In my case, in radiology, I could have done an internal medicine year, I could have done a surgery year, or what I chose to do was a transitional year where I rotated through multiple different specialties. It was kind of like doing 3rd year of medical school all over again, but I got paid doing it. I was able to put in orders and actually be a lot more of a useful team member, is what I chose to do. You can do any of those. Not all specialties require this. If you end up matching into internal medicine or family medicine, you also have an intern year, but it's not separated. It's a categorical program, so then everything is seamless. You go from PGY 1 to 2, all in the same program. Another question, what helps you stand out as an RN to medical school application? It's kind of a funny question because I think that being an RN in and of itself helps you stand out because you've had like thousands of hours of clinical experience prior to applying to med school, where other traditional students who are going straight from undergrad may not have had. So I think just being an RN helps you stand out as a standalone. But if you want to stand out more as an RN when you're applying, I suggest you get involved with things within your unit. If you have an opportunity to take on leadership roles like being a charge nurse or joining a committee, I highly suggest that you do that. When I was an RN, I was part of a rotating pool of charge nurses on my unit, and I also joined the scheduling committee. So that was a committee that just helped with scheduling the nurses, and I was able to put that on my CV. Other things that you can get involved with are quality improvement projects. You can shadow the doctors that you rotate through your unit, And those are all things that you can do to help make you stand out on top of being an RN, because you want to make sure that you're well-rounded. Here's a radiology question. Any early thoughts on a future rad specialty and any favorite type of imaging to read? So I'm a newbie R1. I'm just finishing up my first 4 weeks of reading. I started on neuroradiology. It's basically kicked my butt. I initially thought that I might be interested in neuroradiology, but after these 4 weeks, I'm not so sure. My next rotation is in MSK. I want to be open-minded to all of these different specialties going into radiology, really not having much background in radiology. So I just want to be open-minded. I want to be able to rotate through all these specialties, be open to liking them. What I've learned about myself is that I enjoy doing procedures. It'd be nice to have in my career the opportunity to do procedures. I can do that in body. So body imaging is imaging of the abdomen. And when you're on body, you can do image-guided procedures like biopsies of the kidneys. You can do drain placements. You can drain abscesses. Those are things that you can do. You can also do interventional radiology. That's not really something I'm interested in doing, mainly because of the work-life balance. It's very similar to surgery hours. And if I wanted to work surgery hours, I would have just become a surgeon. So I don't know if I would want to do that. There's also a field of breast radiology, which I learned about when I was in medical school. I did a 4-week rotation in breast radiology when I was a medical student, and I also did a rotation in breast radiology when I was an intern. This program that I'm in for radiology actually exposes us to breast radiology in our first year. Not many programs do that, so I'm really excited that I get that exposure next spring. Breast radiology is reading mammograms, MRIs, and doing biopsies of suspicious lesions. You can do that guided by ultrasound, stereotactic guidance. I think that's through like mammography, and then also image-guided biopsies. I like the idea of being able to do very precise procedures that are low risk, and I like the idea of being able to work with patients in this specific group, this specific demographic. So I'm going to be very open-minded to that. It's one of the specialties in radiology with the least amount of call. What resources did you use to help study for the MCAT, Kaplan or UWorld or something else? I actually used both. I used Kaplan for content review and I used UWorld for question bank. What I suggest for you is pick no more than 2 resources and stick with those. You're going to get bogged down by all the amount of resources that are out there, and you're not even going to get started studying because you're going to be bogged down by that. So just pick 2, stick with those, and don't even research other ones. UWorld is excellent for a question bank because not only is it an excellent source to do practice questions, it gives you really good explanations for those questions that you get right or wrong, which you should be reviewing both the questions that you get right and wrong. This isn't a question that was given to me. It's just a statement that says, I am old to go back to school now. That kind of makes me laugh because, listen, age is a societal construct. You should not let your age limit you in doing the things that you want to do in life. We have this one lifetime to do the things that we want. You should not let your age stop you from doing that. I think people should be reasonable in how they pursue things. If you already have $200,000 of student loan debt, maybe going into another $200,000 of student loan debt is not a great idea. Those are things that, you can work with a financial advisor. You can see if you can get scholarships. I think that's a whole separate conversation. But if it just comes to age, I think you can be reasonable about it. Medical school is a very long, arduous journey, but I've seen and known people who pivoted and changed their careers in their 40s even. One of my instructors in medical school was a cardiologist who was in her 70s, and because she loved what she does so much, she was still teaching us in her 70s. She was a nurse and then became a nurse practitioner. She was a nurse practitioner in cardiology, and she looked at the cardiologist and thought that she can do what they are doing. So she decided she was going to go to medical school in her mid-40s. So in her mid-40s, she started medical school. That took 4 years. And then she did 3 years of residency in internal medicine. And then she did another 3 years of fellowship in cardiology to become a cardiologist. So just know, what does that mean to be too old? I feel like you're too old when you're dead. All right, this is going to be the last question that I answer. Someone just said, about to graduate my AADN. I don't want to stop my education, struggling with deciding between NP, CRNA, or MD. I can't tell you what to choose, but I can tell you why I chose the route that I chose. I chose to get a medical degree because I wanted to open the most amount of doors for myself and have the most amount of options. Had I not gone to medical school, I would not have been able to match into diagnostic radiology and become a radiologist. I wouldn't have even known about the field because that field is not really readily available to an NP. I wouldn't have even known that I enjoyed or liked radiology without going to medical school. That's what exposed me to radiology. I chose this route because I wanted to open the most amount of doors. You are going to have to decide your why and why you want to go whichever route that you choose. There's no wrong route. It's just what is right for you. And you have to decide that for yourself. That is a very deeply personal decision to make. I can't tell you what to do. I can just tell you what I did, what works for me, and that's not going to work for everybody. So just figure out what feels right for you. It can feel scary and overwhelming, especially if you have no doctors in your family, if you've never seen someone close to you do this or accomplish this. That can feel very scary and alone or lonely. And that's literally why I'm here on YouTube and on Instagram, because I want to share this with everyone. All the things that I wish I had known when I was going through this alone as well. I didn't have people in my family who were doctors, so I didn't know that it was even possible for me to get where I am. So I'm just here to share what I know and let you guys know that you guys can do it too. I hope that answering some of these questions gave you insight on the RN to MD journey, the route that I took, and how you can do it too. Thank you for watching my video. Know that I have a guide out, the RN to MD guide. I'll link it in the description, and let me know if you have any other questions. Thank you for watching.